Well, thank you all for inviting me tonight. I appreciate the opportunity to address the Pink Ladies here of the PRMA Associates. And my name is Greg McNeely. I'm an occupational therapist. I've been doing occupational therapy for about 18 years, going on 18 years now, and working as a lymphedema therapist at this time, and with LymphedemaMD. I'm not here to advertise, I'm here to do a talk though. And I just wanted to show you this is the other ladies on our team. Rebecca and Lucy are our other team members. And we treat lymphedema. And is everyone familiar with what lymphedema is?
Yep. I'm not.
Sorry? I'm not. Okay. Well, you're in luck, because I'm going to give everyone a lengthy story anyways. So, I'm going to get my... I didn't realize I was going to be broadcasting worldwide, so I'm going to puff out a little bit more, stand a little straighter, and here we go. So lymphedema is... Actually, I want to talk more about the normal circulation of the body. That in your body, the heart is continually pumping fluid throughout your body, and that's represented by this part of it here. If this is too small, I mean, feel free to kind of step up and join me on a global stage here. As you know, the heart, the circulatory system, the heart is pumping the blood through the body. And it's leaving fluids behind. Sorry, I'm going to set things aside here. So, pumping the fluid through the body. This is kind of representing the interstitial space, or the cellular level, the capillary beds, where that's the end point of the arteries and the beginning point of the veins. That's down to your very fingertips. It's on the surface of your arms. It's throughout the body. So the blood is being pumped through the body, through the arterial system, and it's leaving behind fluid and nutrients for the body. The venous system picks up about 80 to 90% of the fluid and the materials that are left behind. And so of that 80 to 90% that returns through the venous system, the lymphatic system picks up the other 10 to 20% of the fluids. That is, as I say, within the intercellular or interstitial space. If there's an imbalance of this system, perhaps high blood pressure or sort of venous blockage, chronic venous insufficiency, that sort of thing, then there will be a buildup of fluid here in the interstitial space, and that can cause, that's what we refer to as lymphedema. And that's a larger protein-rich fluid that's left behind. Normally the lymphatic system is taking away the larger proteins and taking away that 10 to 20% of the fluid as well. The other, I'm going to step back and get back on the page here a little bit. I just started rambling, and that's why I brought some pages along to keep me on track. I did make up a PowerPoint, but we don't have a projector, so I'm going to go ahead and be using the pages here, just so you know. So so I'm going to stop and make sure I'm covering everything that I intended to cover. So far, so good. And we can leave a copy for you as well. Although there are so many resources on the web as well, if you need to look into lymphedema, there are a lot of great resources out there as well. So, we're talking about the circulation, the interstitial fluid, the buildup of fluid. The other, so talking about lymphedema being the buildup of fluids and proteins within the interstitial space. I mentioned about high blood pressure or venous insufficiency. Also, if there's a disruption of the lymphatic system. And that can be caused by surgery, and often it's after, if someone has been diagnosed with cancer, often the lymph system is where it may be detected, one of the places that is affected by it. And so if there are lymph nodes that are removed, and particularly If someone has breast cancer, they have a mastectomy, quite often they have to remove lymph nodes. And that doesn't necessarily mean that it's definitely going to lead to lymphedema, but there can be that tendency towards it. So, lymphedema, there are different, so we're kind of talking a little bit about the causes of lymphedema, also the stages of lymphedema. There's stage 0, where if you have some sort of vulnerability to it, and often that might be after an injury, it might be after, if you've had lymph nodes removed, you might not be showing any sort of symptoms. That would be considered stage 0. That your, the capacity of your lymphatic system might be reduced, but it's still able to handle the demands that are placed on it by your body at that time. Sometime in the future, if your body is taxed more, then that can, again, reduce your lymphatic system's capacity, and then you might start to show symptoms of it. So that was stage 0. You have no symptoms, but you may have a vulnerability to it. Stage 1 is reversible or intermittent swelling.
Hi, sorry I'm late.
Yeah.
Hi.
So stage 1, we're just talking about the stages of lymphedema.
Yes.
So stage 1 is reversible with intermittent symptoms. You might have swelling that will go away. Maybe if you elevate your arms or legs, whatever area is affected. And there can be pitting. So if you actually press on the skin, you can actually see that it stays dented, sort of like a memory foam. I bet you can still kind of see that. Stage 2 is when it gets a little bit worse. It's irreversible at that point, spontaneously irreversible. That it's difficult to hit. It's something that doesn't go away when you elevate your arm or leg, whatever is affected. Stage 3 is more serious. Has anyone seen the pictures of lymphedema on the internet? Anywhere? Do you see some of those? Stage 3 is, they refer to it as elephantiasis, and that is, there's a significant thickening of the skin, there are papillomas or little raised bumps, that sort of thing. That is a lot more difficult to work with, a lot more difficult to reverse. That condition generally can be improved, but in terms of getting right back at 100%, that's a lot more difficult. So, the industry standard for treating lymphedema is complete decongestive therapy. There are 4 aspects of complete decongestive therapy. And I should have asked about the time. Actually, I probably need a timekeeper because everyone who knows me knows I can go on for a very long time. What sort of time do I have left at this point?
You're fine.
You're fine. Yeah, you're good.
Okay. All right. Actually, I was thinking if Margaret or Shanna could move the chair over, they could just kick me when it's time. That would be my clue. So complete decongestive therapy. There are 4 aspects: manual lymphatic drainage, compression. There are various forms of compression that we use, and skin care and exercise. And manual lymphatic drainage is it's a light stretching of the skin, and it's done in a particular sequence. The stretching of the skin, this is where I'm going to start talking about the picture again a little bit. The circulatory system, as you know, pumps through the body, throughout the body, and it goes in a circular way. Basically, it has a start, an end, and it's going just in a cycle all the time. The lymphatic system is a one-way system, and that's depicted here. The entry to the lymphatic system is depicted here with this finger-like structure, and that is the lymphatic capillary, and it's suspended within the interstitial space or intercellular space by filaments. And the way the lymphatic capillary is open is when there's a stretch on these filaments, whether by movement or with an increase in the fluid. Generally then the capillary opens and it allows in the fluids and the larger proteins. Once into the lymphatic system, it goes into the vessels, and within the vessels, if I might get a little theological for a moment, I often say, if somebody doesn't believe in God, just to see the simplest cell of the human body is just incredible. And this, within the lymphatic vessel, it's kind of a combination of the arteries and the veins. And it has stretch receptors, the vessels of the lymphatic system, so the fluid and proteins have entered. Now they're starting to stretch the vessels of the lymphatic system. As it stretches, there are pressure sensors, stretch receptors that cause a contraction of the smooth muscle within the vessels. And there are also valves, like in the venous system. So that causes a one-way movement of the fluid. So it causes that, the stretch causes a contraction, and then causes a one-way direction, the flow of the lymphatic fluid. So we do a light stretch. So still talking about manual lymphatic drainage. I say that for yours and my benefit, because I might be talking about daisies in a moment if I don't keep on track here. So manual lymphatic drainage. With manual lymphatic drainage, there's a process. I often talk about one of the houses that we used to live in had the backyard was kind of sloped up a little bit. I'm not going to mention the daisies, by the way. This is relevant. The slope would come up towards the house. When we would get a heavy, sustained rain, that water would start to fill up the backyard and start coming towards the back door. So we could step out of the back door with a broom and start pushing that fluid away, but it just wants to come back. So if you had swelling in your arms, that would be like starting at the fingertips and working the way up. Instead, what I would do, I should mention as well, my wife and I have 7 children, and I do believe in child labor if they're your own. So we get the kids or myself and the kids, I should say, the older kids, out to kind of the side yard where that water should be draining, and we start to pump that water out with some shovels and that sort of thing. Get the water flowing where it needs to go, so we create that kind of siphoning effect. And then we can work our way back to the door where the problem would be, and then we can push that fluid away. So it's a similar sort of thing with the human body. And if somebody comes up with a better analogy than that, let me know, because I'll use it. But that's the best one I can think of. So we create that siphoning effect. And that's what we do with the body. The thoracic duct is the main outlet, the final outlet for the lymphatic system. It runs along from your abdomen up to the subclavian veins, and that's the blue depicted here, the subclavian veins. Sorry, is that?
I can see.
Okay. So the veins up here, the subclavian vein. The thoracic duct is the outlet for the lymphatic system. What we do is we start with a pumping of around the subclavian vein to try to create that siphoning effect. So we're using the lymphatic vessels, that one-way direction, to try to do that alternating pressure to get that pumping action started. So we're starting to clear that fluid from up here. We work our way down to the abdomen. Then, if you've had a problem, let's say with your right upper extremity, then we would start, after we could go from the top to the abdomen, then we would go over to the axillary node on the working side and start pumping on the nodes of that side. So, let me sort of get myself straightened out and all of us to be sure we're on the same page. If your right side is affected, we're going to go to your left side, start doing the pumping on that side, just underneath the axilla to try to get things moving. So we work here, here, then we're going back to the nodes on the other side. And so we're creating that flow. I should also say too, the thoracic duct is quite deep. It might be about the size of, I don't know if you can see the vein on the back of my hand here, but it might be about the size of that vein. To get that fluid moving, I can just do a little bit of pumping directly over it. But the thoracic duct is deep. It's towards your back, just in front of the spinal muscles, and there's no way we can physically get to it. So we're trying to do that alternating pressure. doing some pumping up here, do some breathing exercises to get that alternating pressure working to try to clear that fluid. How am I doing?
Good, keep going.
Everyone with me? All right, I just want to make sure I'm not just rambling on too long and losing everyone. So we're at the thoracic duct, we're trying to get that, that fluid moving through this alternating pressure. Then when we get to the nose, they are a little bit more superficial, so we can work a little bit more directly over them, doing a little bit of a pumping action. This is another thing, when I start getting a little theological about the vessels, similarly, there are redundancies in the human body that we can use to move that fluid. This is some of the watersheds of the body. This is where the fluid generally travels from. So if we're working on clearing a section, we're going to work from these brown lines toward the appropriate nodes that would go to. I'm just going, everyone's okay with, I'm talking about lymph nodes, that sort of thing? Yes?
I'm sorry. If the terminus of the thoracic pumping system is in this area, where does it go once it's...
Oh, it goes back into circulation. So it's going into the subclavian vein, which then goes back to the heart. So it's going to go through, and that excess fluid and the lymphatic fluid will be processed through the body then, through the circulation. So through the kidneys, that sort of thing.
So lymph fluid is pumped by the heart?
The lymph fluid will go back into circulation, and yes, be added to the blood flow, and the heart will pump that as well. Does that make sense?
Is it a separate system from the veins of the heart? Or are you saying...
It is. It's separate
incorporated?
until it goes up to the subclavian vein, and then it's added back in. And I should say the numbers that I've seen for your circulation, your heart is pumping about 7,200 liters of fluid every day, whereas the lymphatic system moves about 2 liters of fluid every day. And so I often compare the circulatory system, if we're talking about moving people, the circulatory system might be like those giant Primo buses that move so many people every day, whereas the lymphatic system might be more like a smart car, where it still moves the fluid. It still has an important function, but it doesn't have that much of a dramatic effect. And that's why we have 4 different aspects to complete decongestion. Did that sort of make sense?
So the lymph fluid is not in a closed circuit. It eventually commingles with the blood in your veins.
Yes. It's a one-way trip for the lymphatic fluid, starting at the capillary beds throughout the body. And it's going through the lymphatic system and winding up, rejoining the circulatory system up here at the subclavian vein. Does that make sense?
So what eventually happens to those proteins?
The proteins along the way, I'm leaving out a whole lot of the story. The larger proteins are processed mostly at the lymph nodes, and that plays an important role with your immunity and everything too.
So what's the etiology of lymphedema? Is it the lack of those stretch receptors?
It's a number of different things. It can be hereditary, so that your lymphatic system isn't developed right from birth. Sometimes it develops, it's notable right at birth, when they're an infant, versus it might not appear, the symptoms might not appear until teenage years, or it might appear later on in life. So that's if the lymphatic system isn't formed properly because of genetic reasons. But the causes of lymphedema can be kind of going back to here, where if there's a high blood pressure, sometimes, if somebody has congestive heart failure, they get swelling everywhere. And generally, we're affected by gravity every day, so it can often affect the lower limbs that much more. And in more severe cases, it might affect the upper limbs. So something like a congestive heart failure, where you have high blood pressure, that can cause too much fluid to be put into that interstitial space. Or if somebody has a chronic venous insufficiency, or some other disruption, and it might be after a surgery as well, where the circulation or the lymphatic system is disrupted, that, again, you'd have, so you might be getting too much this way from the arteries, or you're having not enough taken back by the veins, so that's being left behind. Or if something's happened to the lymphatic system, then that might also cause too much of a buildup, the lymphatic fluid. Does that answer the question?
Why does too much heat cause lymphedema?
It doesn't necessarily. That heat can affect it because it causes the dilation of the blood vessels, so that might cause more fluid to be left behind. So generally, heat can have an adverse effect if somebody has lymphedema. So that's so manual lymphatic drainage. We're kind of at the thoracic duct. We're moving more to the surface in the nodes, lymph nodes. And if somebody's lower limbs are affected, we would go with the inguinal nodes and start to do kind of a pumping directly over those nodes to try to get things moving through. And then, once we're onto the affected limb, actually let me go back to this for a second here, before we get to the affected limb, because I was about to mention about these green areas here. I was mentioning that the brown lines represent, and I'm just thinking, I don't know if these, I have to give credit to Solaris for their pictures that we're using on YouTube right now. Or not, but they already did. I don't want to break any copyright laws or anything. But, so these brown lines represent these watersheds. However, the way we're wonderfully made, that we have these, they're called anastomosis. It's a redundant system, so that we are able to move and help through manual lymphatic drainage to move some of the fluid across those watersheds. And this is one of the areas here across the front, or from the inguinal area to the axillary area, or the other direction. So if one of your arms will be affected, and we're saying the right arm, if the right arm is affected, we've gone from here to the abdomen. Then we're going over to your good side to do some pumping here, because that's the, again, we're creating that siphoning effect I was mentioning about my backyard. And so we're working with these lymph nodes. Then we're going to move the fluid. Let's kind of flip the picture around. This is the good side. And then we're going to work, try to get the fluid moving across from one side to the other. Then we're going to work on the affected side. So this person would have some swelling in the right arm. So then we're going to start working down the limb. So we've created that siphoning effect. We've got things clearing out of the lymphatic system. And now we're going to work down the arm. And that manual lymphatic drainage is just that light stretch of the skin that we're trying to get. We're trying to activate the lymphatic capillary. We're trying to get the fluid into that, so it can, so the fluid can help to go through the lymphatic system. So then we work towards the fingertips that way. That's all of it. That's manual lymphatic drainage. That doesn't qualify for certification in case you're wondering. That's just that's just scratching the surface a little bit of what that's about. So the second part of complete decongestive therapy, and that's, I kind of mentioned that we talked about the four aspects. Each on their own are good, but they're not enough. That you need the whole package to kind of get things. It's a comprehensive approach to really effectively work on lymphedema. So that's manual lymphatic drainage. Then compression is another, is the second part of the complete decongestive therapy of the four things. And I've mentioned manual lymphatic drainage, compression, skin care, and exercise. So compression, there's a few different kinds. And I actually did miss one of my slides here, where I would talk about two phases of complete decongestive therapy. The first phase is when you get professional help for it, where you go generally to a clinic. You would get some help to start to bring the volume down. That's the intent of the first phase of complete decongestive therapy, to reduce the volume of the affected limb. And once you go through a period of time with that, it might be 4 to 6 weeks of treatment, that sort of thing, or whatever you're needing. Once the volume is reduced as much as possible that you reach a plateau, then the second phase begins. That's the maintenance phase. During the intensive phase, you're taught how to do some of these different things: self-manual lymphatic drainage, self-wrapping, skin care, and exercise. The second phase, then, you take it on yourself. Because as you're going through this, whatever situation people are in, if you've been diagnosed with something, suddenly you're going to be doing a whole lot of research on the internet, you're going to be talking to people, you become an expert in it. An unwilling expert, but an expert nonetheless. You're with you 24/7, so you know yourself the best. And so the part that we play is to try to teach you about how you can keep that under control, so that you're ready for the second phase, the maintenance phase, to be able to do that manual lymphatic drainage, wrapping, skin care, and exercise. So the compression. The first part is we use, I'm still okay for time? I've still got about another 50 minutes or so. Pick it up a little bit, people are falling asleep, and then I'm falling asleep right now. Wrapping. So we use a short stretch bandage. It looks somewhat like an ACE bandage, but ACE bandage is a long stretch bandage. You can stretch it out all day and it wants to go right back to where it was. We use a short stretch bandage that only has a specific window of stretch that it will, we use that to wrap away from distally to proximally, so closer to the heart. And we're trying to use a graded compression, so it's a little bit stronger towards, distally towards your fingertips. Again, using the arm as the example. And it's going to get a little bit lighter going up, so the wrap won't be as tight, there won't be as many layers going up higher. So that general pressure is going to kind of encourage the lymphatic flow. And again, if you picture, I don't know if you've known somebody that might have lymphedema, you see that kind of swelling where the fingers can be uncomfortably swollen, the arm. We've been able to, we see some people that have been in some pretty serious circumstances, and it's so gratifying to be able to see them where we reduce that volume back to a more manageable level, and that then your arm is not this burden on you, that it's able to, you're able to do more of your regular activities. So, wrapping. I'm going to try to pick it up a little bit here, because I think we all might be sleeping. Everybody might be napping before excuse me for a minute. So, compression wrapping. This is the first part. We do it, we do a wrap of the arm. It's multi-layer, it's graded, so it's tighter towards the end, but it's not something that's uncomfortably tight. It's something that should feel snug, but it shouldn't cut off circulation. The whole intention is that it's assisting the circulation. Also, with that boundary, when somebody has lymphedema, with that swelling, your skin acts as a normal barrier. So when you are using your muscles are helping with a pumping action to try to get the fluids moving. But when you have lymphedema, your skin is retreating from the fluid. Let me get a close up here. So your skin is retreating from the fluid. I'm just messing around.
I love it.
Anyways, as the skin is retreating, it's almost like you're lifting the oars out of the water. That your muscles are less effective because the skin is moving away. It's not, the muscles aren't able to act as effectively as a pump. So when your arm is wrapped, that gives an external barrier. It facilitates also the muscular action. I'll kind of jump ahead, just generally with the exercise. It's not a lengthy discussion about it. That basically every exercise that you can do will benefit. That especially while you're wrapped, if you're exercising your muscles. And again, I'm not talking about doing marathon training or Ironman training, that sort of thing, or even joining a gym. Just simple exercises. What might be fitting for somebody else can be that simple exercise that you need to do, that you're opening, closing your hands, you're working your arms, working your elbows. And there is not a specific sequence of exercises that you need to do for lymphedema, but every exercise will benefit. But you can kind of go in an order from distal to proximal, that you're and back again, that you're working the muscles to try to help move that fluid. Yes?
Okay, this is my first class and I just want to ask.
Uh-huh.
Are you more prone to getting it if you have cancer?
If you've had cancer and it's affected your lymph nodes, then yes, it can, you would be more vulnerable to it. That's kind of going back to the stages of, that would be stage 0, that you might be, if you've had some effect of your lymph nodes, or lymphatic system, I should say, then you might be at a higher risk for it.
And is it shortly after, or, I mean, it's just whatever?
It can be latent for years.
Oh, okay.
And you might never have a problem with it. But, you know, or it could happen a little more.
Sorry. Sorry, I'm so late.
No, that's fine. There's a chair right there, yeah. Go.
Okay.
We're being broadcast globally, by the way, just so you know.
Okay.
No pressure.
No pressure.
So,
I've only been on the lake for an hour and 45 minutes. Oh, God.
So, we were talking about wrapping, and I kind of talked a little bit about exercise with that. So it's good to exercise, especially when you're wrapped, because you have that support, that external support that's going to facilitate the use of your muscles.
Does exercising help from getting it? I mean, is there certain exercise?
Well, I would say that with any condition, generally speaking, that your general health, then that's going to have a positive effect on various conditions, and I would include lymphedema. We hear of people who, if they lose weight, they exercise some more, that can have a positive effect on blood pressure, diabetes, lymphedema. I would include in all that as well. I can't quote any studies, but I would say, you know, as your general health is improved, then your that would have a positive effect on your condition as well. Okay, so the wrapping. So while we're doing the intensive phase, we're wrapping you. We're teaching you how to wrap yourself. Then, when we get down to a plateau or that we have reduced as much as possible, hopefully to the way your other arm would be, then at that stage we would look at recommending garments. There are compression garments that you can use. And I have a sample. Actually, we'll pass this around. This is one particular company. I'm not, again, advertising for anyone in particular, but this shows some examples of some of the upper extremity sleeves that you can use. So it's a compression garment. Once you're above, I believe it's 20 millimeters of mercury, that sort of pressure, that you would need a prescription for it. That, and you might be able to use an over-the-counter or a standard size, or you might need to have a custom ordered size. But that, during the maintenance phase, you can use the garments. The garments are not intended to reduce the volume. They're intended to hold your arm at the volume that it's at. Arm or legs, that's what's affected. So, compression, wrapping, intensive phase, garments during the maintenance phase. Also, you do some self-wrapping during the maintenance phase. Again, you get to know what exacerbates your condition, what makes it worse. So it might be after you've gone through the intensive phase, if you like to garden and you're out working in the garden, maybe you're using the garment already, which you might need to go back and wrap for a day or two as well to try to bring the volume down if you notice there's an increase. Certainly if you fly or that kind of thing, you need to have a garment, some sort of support because people will notice that there will be an increase, because the increase in altitude is a decrease in the pressure, the external pressure on your arm, so that's why it might increase. Also, another form of compression that we use during the intensive phase is vasopneumatic pump. That's a sleeve that goes over your arm or over your leg. That has, ideally it's segmented, so it has a number of different compartments. That it's sequential, so it would start from distal to proximal, and it would be graded, so it's tighter towards the end, and it has less pressure towards the top. And I mentioned measure it in millimeters of mercury, and that is, it's, if you can imagine that the pump would be similar to a blood pressure cuff. It's the same sort of idea, except, you know how my nursing friends have a talk about that they're trained to take it up to 200 millimeters of mercury and then drop it back down. That's about the point where it feels like your arm is going to fall off. We don't need that kind of pressure. Usually, often they recommend for the legs about 60 millimeters of mercury, for the arms 50 millimeters of mercury. So that feels like it's snug, but it shouldn't hurt. So, ideally you would be able to have a pump that you can use at home for those times that you need to, for regular routine kind of use, but also for if you do have a time that you need to use it some more.
Now, is that something different than the FlexiTouch equipment, what you're talking
I
about?
think that is one of the systems.
Mm-hmm.
There are different vendors out there. There are different systems that you can use, and that's certainly one of them. And they do have, there are some different ones on the market that have different approaches as well too. So they use, one thing I would say, generally they would use a single compartment pump in the past, and that's not really that effective. That it's better if it's segmented and has a sequential sort of graded approach to it. So, okay, so let's talk about compression. I'm on page 2 of 50 now, so I think we're doing pretty well. Thank you for laughing at that. Margaret's over there laughing. I'm seriously going to come over here and kick me if I don't pick it up right yet. So we talked about exercise already, but I'll talk just a little bit about skincare. Okay, I don't really have 50 pages left. I only have this. We're almost there. As I would tell the kids on a long trip, we're almost there. But you're not my kids. Just want to be clear. I've been married for 20 years now, so I know to watch what I say with my wife, because she could kill me in my sleep. She's not a violent person, but just keep that in mind. Anyways, so skincare. And again, this is fairly quick as well. Normally, with the flow of the fluids through your body, I kind of picture, I mean, I try to do it more of this idyllic mountain stream that's delivering the fluid, the water, and it's providing the water and nutrients for the things along the bank, and it's taking away some of the debris. That's kind of what our circulatory and lymphatic system are supposed to do in our body. If you have lymphedema, you have a buildup of that fluid, it gets a little bit more swampy. That basically that fluid is not flowing through freely, it's backing up, and that makes you a little bit more vulnerable to infection. So if you have even a bug bite or a scratch or a cut, that sort of thing, that can potentially lead to infection because that fluid's not moving. There's potential for bacteria, germs, that sort of thing to grow there. So it's very important to take care of your skin, just basically through lotion, keep that, and that your skin is that barrier from the outside world that protects us from so many things. You want to use lotion to keep it moist, keep it healthy. Bug repellent if you're out at a time that there are a lot of mosquitoes or other sort of bugs, that sort of thing. And sunscreen, of course, because as so the skin is kind of compromised when you have lymphedema. All right, I mentioned about exercise. Everything is helpful with exercise. Generally speaking, I also, like everything else, it's a balance. That, you know, you might not want. I do know of people, and I've been it's been interesting to see people who really do work out, who do run in half marathons and that sort of thing, and that's a great thing. As I say, your general health will have a positive impact. Good general health will have a positive impact on your condition. So I've known somebody who does some running and has presented great challenges to me for wrapping and keeping wraps that will stay with them as they're running and everything, and that's great. I appreciate the challenge. But at the same time, you need to find that balance. You don't want to exercise too much because that can cause you more problems. But also, I think for most of us, it's a question of exercising through it. That we need to kind of keep at things, make sure that we are exercising enough. And you don't want to favor that so much. You don't want to have it wrapped and just kind of rested on pillows and that kind of thing. You might want to be working on it. And that depends on where you're at in terms of And this actually, what I didn't build in as much specifically in the presentation is talking about post-mastectomy. I did some research online and I was so impressed with what they do here at PRMA with some of the surgeries that they do, which have changed so much over the years. And that we would look at, you know, generally where you are post-surgery, where you are in terms of treatment, and be quite sensitive to that. And so those are different other considerations that you might take. That if you did have symptoms right away after mastectomy or that sort of thing, you know, we would have to go with what the doctor says in terms of treatment and that sort of thing. So we'd have to kind of monitor the condition and that sort of stuff as we go. Exercise, lymphedema. So there's no cure, but it can be treated and managed like other. I often refer to diabetes, that it's a long-term, lifelong condition. That's what lymphedema is. And once you do have it, then you need to stay ahead of it for your lifetime. But it's not something that there's a cure for. Actually, I want to mention over PRMA as well, that I understand that they're trying to put us out of business. I get that. As they're doing, and I appreciate that as well, that the more they advance, the more they improve surgeries and that sort of thing, and make it so that, I always tell people, I don't want to have to work with you. I'd rather you are doing well, you're living your life, you're not needing any sort of intervention at all. And that's what everyone wants. See, I'm off the page now with that, but I'm actually almost done here. So that's the good news. So I mentioned before, lymphedema, it's like your general health. It requires your commitment, your perseverance. You are the one who's going to make it successful. I always say that you're the most important therapist on the team, that you're the one that's with you 24/7, you get to know it the best, and you're the one that's going to make sure that you're successful long term. Oh, sure, we will torment you while you're with us, but, you know, not torment. And does anyone have any questions? Do you want me to go on about anything else at length? Or?
I have a question.
Yeah.
I know the fluid accumulation, but is it normal for the upper part of your arm to just look like a regular arm, and then from like here to about here is where the accumulation wants to be?
It can be. Different people will have different, as we have similarities, we can kind of map out the human body and everything, but everyone is just a little bit different. Some people would say I'm a lot different. But anyways, that's a joke. My brothers would certainly say that. Anyways, no, that everyone's a little bit different, so everyone's affected a little bit differently, and it might be sometimes that there are difficult areas in the mid-arm or the mid-leg, that sort of thing. But that's where we would do the general approach, but then you have to kind of customize it individually as well, and sort of see if there are specific problem areas. So that, yes, that isn't uncommon.
Thank you.
Yes.
Are these covered by insurance, these sleeves?
That's a good question. I mean, some of these things are, some insurances do cover garments, bandages, pumps, some of the different things that you might use to work on lymphedema. I know the Medicare does a different thing as well. So some of them would, you'd have to kind of check with your insurance at that time and kind of see what would be covered and what wouldn't.
To get evaluated for the lymphedema pumps, who do you have to see? Do you see your oncologist or do you see your surgeon?
Ideally, it would be through a course of treatment of the lymphedema.
Right, because I've done all the treatments like the sleeve and the lymphatic drainage and everything, and I still have it. So to get evaluated to see if I qualify for the pump, who would I need to talk to?
Certainly an office like ours, or you can talk to physicians. I know order them sometimes as well. Definitely you want to be trained well enough in it that you're able to use it effectively.
Okay.
So with the proper pressure settings and that sort of thing. Any other? I will say too, we had some, sometimes people have, with the upper extremity, we look at a pressure of about 50 millimeters of mercury for the arm. Had somebody one time that got a pump, and she thought, well, 50 is good, and 80 or 90 would probably be better. No, that's not the case. So when you don't want to be using it too long, you don't want to use it too much at a time or too much pressure, that sort of thing. So it is good, I mean, to get some professional guidance ideally. So. Any other questions? Yes?
What about scuba diving?
Scuba diving. Actually, if you can do it, see, I can't swim, so I wouldn't be able to do it. Actually, I think the pressure would be awesome. That would be great. And, we talked about going up in a plane and how there's less pressure when you're 10,000, whatever, thousand feet up. That's if you picture the idea of we're in a giant pool of air, and the deeper we are, the more pressure there is. So the higher up we go, the less pressure there is. So if you're going deeper still and doing scuba diving, then, as long as you don't have any other conditions that keep you from doing that, then, I think the pressure would be great. I wouldn't be able to help you out down there.
What would you recommend to prevent lymphedema? Like, I would assume maybe the diagnosis of lymphedema has to do with disproportionate swelling, and so maybe would it behoove us to have baseline measurements before anything ever occurs?
Actually, that's a good idea. That would be a good idea to have those baseline measurements.
And does your lymph system atrophy? How do you keep it in shape? Are there any gradients that use certain minerals or something that you can make sure that you have in your system?
That's a great question. There are different things. I mean, I've seen some different, there's always all different sorts of alternative medicine that's out there that's advertised to do lots of different things. And I can't say one way or another with some of them. I do believe in prevention and natural approaches. That is all very good. I think to be careful and make sure that it's something that is, that will actually help with that. But I think in terms of prevention, I think your general health, it's hard to predict it. I think if you've had any surgery that has definitely your lymphatic system, removal of nodes, that sort of thing, then, as I say, that would be generally, that would be considered a stage 0 of lymphedema. So taking care of your general health. I think monitoring somewhat, but at the same time, sometimes when you have any sort of condition, if you've been through cancer, if you've had surgery or radiation or something, or if you've had any other condition, asthma or any, that sort of stuff, sometimes we start seeing life through that kind of filter, that we're thinking, if something bad happens, that it relates back to that. So, but that's not necessarily the case. But you don't need to worry about it too much, as in having really precise measurements. Your body varies in size. You talk about your water weight from early in the day to late in the day, and just different things like that. But our bodies do change.
What you eat can affect.
Yes. Yeah. And so generally your general health is the best prevention.
Why, if contracture and this pump that you mentioned is beneficial, do some people claim that the onset of their lymphedema was from having a blood pressure taken?
Well, if they have any sort of vulnerability, and if the blood pressure, is at a really high pressure, that it's caused some sort of problem, then that might be, lymphedema can be triggered by trauma. So whether that is some severe malfunction of a blood pressure cuff, or it might be infiltration of an IV or that sort of thing, or an injury that might trigger something like that. Any other questions?
So if you have a patient that's at stage 0 with lymphedema, How long, like if they're frequent flyers, if they travel a lot, would you recommend them wearing a sleeve, and for how long after surgery should they continue wearing a sleeve, or is that something you don't do unless you develop symptoms?
I mean, generally, you would find out on the first flight. And it's, it's something that develops. It's not something like you might, if you start to notice it on that flight, then I would, it would probably be a good idea. I would certainly consult with your physician. And I'm saying that legally for the camera here, that I want to be sure I'm covered here. Do I look good on screen? Am I okay? I mean, there's only so much we can do here. But well, this kind of comes back to the same sort of idea of
Just
technically
keeping an
you'd be
eye.
considered at stage 0, but unless you notice symptoms, I wouldn't necessarily go out and buy the stuff.
And they shouldn't have to feel like they need to wear it for certain months after surgery, as
Right.
long as they don't develop any symptoms.
Do what your doctor says. Always do what your doctor says. So, for sure. All right. Well, if there's no other questions, I'll just walk out the door.
Thank you so much. I truly appreciate it.